some days. There isn't a requirement to report to SA Health within a specific time frame, so we're just trying to tighten that up. But unfortunately, 7 deaths to report today. 6 of them are women aged between 60 and 100, and then there's a further gentleman who has passed away who is in his 90s. So we express our sincere condolences to all of those families who have lost a loved one. 7 deaths to report today. In terms of positive cases, we have increased from yesterday up to 3,715. Now, 2,978 of these were reported through PCR testing and a further 737 through the rapid antigen test provision, which is on the SA Health website. We did have an increase yesterday in the number of tests which were processed in South Australia, up to 19,398. And so a massive congratulations to all of the pathology staff in South Australia, those people at SA Pathology, as well as those people who are working within the private laboratories in South Australia through working through some pretty extreme times yesterday with extreme conditions and heat, but we did have an increase on the previous day. Good news in terms of hospitalisation, we've seen a quite dramatic reduction in the number of people in hospitals in South Australia. In the 24 hours to midnight last night, we had 190 people in our hospitals in our state. So that's quite a reduction on the previous day. Look, these numbers do bob around a bit, but that's pleasing to see that hospitalisation has come down. Unfortunately, we now have 27 people in ICU in South Australia, and of those 27, 6 of them are on ventilators. The vaccination program yesterday went very well, 17,691. What I was particularly pleased about is that we had about 1,500 people who had their very first dose. So I think the message is getting through that there's a massive, massive overrepresentation of people within ICU in South Australia, within hospitals in South Australia who are unvaccinated. This disproportionately hits those people who don't have that vaccination protection. So 1,500 new vaccinations for the very first time yesterday, and a total of 17,691. Obviously, Mile End opens today, so there'll be a lot of very relieved people who can go and get those extra positions with their boosters. In the first week, we'll do 5,000 additional boosters through the Mile End site. That will increase up to 15,000 in the coming weeks. I can also tell you that we're well underway with our plans to distribute an additional 10,000 new paediatric doses to our primary healthcare sector in South Australia. So this is our fabulous GPs and pharmacists in South Australia. What I can report today is that we're now going to make a further 10,000. So that'll be a total of 20,000 additional paediatric doses, which will be made available this month in the lead up to school returning in South Australia. So that is also absolutely fantastic news. We do unfortunately have more SA Health staff who are COVID positive. In fact, we now have 524, and that means 892 in total in terms of those people who are furloughed and can't go to work. But as I said yesterday, many of these, in fact, probably the majority of these, are involved in our COVID-ready care team, the cricket team, which is supporting the many thousands of people who are now living with COVID in their own homes. So that's a good use of that finite resource. In terms of our return to school policy, we are ready to return our result to the people of South Australia by the end of this week. So we are on track to finalise our position by Friday this week. Obviously, we have the National Cabinet meeting tomorrow, and we will get further advice. We had both the Minister, John Gardner, the Chief Executive, Rick Purse, join us with the COVID Ready Committee this morning. We're looking at various options. Obviously, our preferred option is to get students back to face-to-face learning as soon as possible. We know that they get much better outcomes. We know that having children stay away from school disproportionately affects the vulnerable in South Australia. So our first choice is to try to get as many people back to school as possible on day one, but we are working through various options. Still a little bit of extra work to do before we're in a position to let parents know of what's going to happen by the end of this week. The big news, of course, at the moment in South Australia is that as of tomorrow we change our regime for close contacts. So this will affect all close contacts that are identified from today onwards. So this doesn't go backwards in time. Backwards in time, people are required to do that day 1, that day 6 testing using the PCR testing facilities that we've got in place. But as of today, if you're identified as a close contact, you can go onto the SA Health website, you can register as a close contact, and then you can organise to pick up those 2 free SA Health rapid antigen tests from our super site tomorrow in the southern parklands. Just a couple of factors with regards to this. Number one, we will be making it mandatory for a positive result to be reported. So as of tomorrow, we will be making it mandatory in South Australia for positive cases, whether they be the SA Health or a privately acquired rapid antigen test. We are going to make this compulsory for you to report. We've already seen very good reporting in South Australia. You will not be required at this stage to report a negative test result, but you will be required to produce and report a positive result. I can also tell you that once you have a positive on the rapid antigen test, you will no longer be required to go and get a corroborative PCR test result. We will be asking people to go onto the SA Health website, register that they're a close contact, using their mobile phone number. They'll then be sent a receipt, not a QR code as previously advised, but a receipt. They'll take that along to show people, and we plan to be able to get as many people through tomorrow as possible. We have the capacity of about 13,000 tomorrow down at that site. The good news is that we have plans to open up a further 10 or 11 sites in South Australia over the next week. These will be a combination of sites both in metropolitan Adelaide and in regional South Australia. But we do really want to see what that operation is going to be like through the site in Adelaide tomorrow. All the testing is being done today, so we've got cases going through to look at how people are received, how they're processed. It should be a fairly short period of time. We are asking people to be patient, especially in the early days. We expect that there will be a large number of people that want to go and get these free rapid antigen tests if they are close contacts. That's why we're limiting it to people that are really identified today as close contacts today and moving forward, rather than going backwards in time if you've already had the PCR test to continue with that. We see and envisage that there'll be a large number of people switching from PCR testing to rapid antigen testing. I would just point out that the PCR testing is still far more accurate and still the preferred test, but we do want to provide this alternative pathway as well. So I really want to thank SAPOL and SafeCom for the excellent work that they have done to prepare for the pickups of the rapid antigen test provided free of charge by SA Health. It's been a massive, massive logistical exercise. We're very grateful for all their work. The other 2 things that I wanted to talk about today, first of all, Operation Limit. We have had another 90 inspections overnight. Again, very, very low level of non-compliance right across South Australia. In fact, in total, the Police Commissioner tells me there's only been 4 expiation notices issued against individuals or corporations since they started this operation. So this represents, I think, less than 1% of all those premises visited. So massively high compliance in South Australia, and for that we're of course very, very grateful. And then finally, I wanted to give you an update on our hospital plan, which is now being called Plan 500. It's an update of the hospital planning that we've had in place right throughout this COVID pandemic. What it will do is it will transfer or decant patients from our 3 major teaching hospitals into the private sector so that we can take COVID positive patients at the Lyell McEwin Hospital, the Flinders Medical Centre and of course the Royal Adelaide Hospital. We already have approximately 190 patients or 200 patients in beds in South Australia. We want to be able to provide for up to 500 in beds right across South Australia. 300 of these will be at the Royal Adelaide Hospital, 100 at the Lyell McEwin Hospital, 100 at the Flinders Medical Centre. This new flexed position will be in place as of today. As of right now, there are some patients, non-COVID positive patients, which are being transferred into the private sector to free up that capacity in our 3 major teaching hospitals, which will also take our COVID patients. As I said yesterday, we are getting updated modelling in South Australia. We have had a presentation earlier this week, and we will get a further presentation later this week with more and more actuals going in, improving the accuracy of the model going forward. What we do know, though, is that when we factor in the likely additional cases, the hospitalisation rate, the average length of stay, 500 beds gives us more than enough for our adult population in South Australia. And I previously talked about the paediatric capacity. We were concerned about this very early on, but I've been advised that the capacity that we have in place at the Women's and Children's Hospital is certainly serving the increased presentations at that site, and we're still yet to have one patient go through to ICU. So I think what we're seeing now is the numbers. Well, the number today is up slightly, of course, on yesterday. As I said to you yesterday, they're going to bounce around. But what we know is there's not such a steep escalation in numbers like we were seeing 2 or 3 weeks ago, and certainly nothing like what we're seeing in other parts of Australia. The hard work that South Australians have put in since Boxing Day, some pretty heavy restrictions in South Australia have slowed that growth, which means that we can preserve lives in South Australia. So I'm going to now throw it open to questions, and I'm reliably informed I'm not going to have any of the technical issues that maybe were experienced yesterday. So first of all, we go to the ABC and Stacey Lee.
Thank you, Premier. Sad to hear the news about 6 deaths today. You mentioned that we don't have a specific time frame or a requirement for deaths to be reported within a specific time frame. Do we know, have these people died in hospitals or at home? And I imagine if it's at home, it's quite distressing for families to be dealing with situations like that.
No, look, I don't have that detail, Stacey, but I'm happy to follow that up and get back to you. Obviously, with the ages, many of them would be in residential aged care facilities where we know that there have been a number of patients who have been diagnosed with COVID. We also don't have the information as to whether they died of COVID or with COVID. So I hope to get some more information on that and bring that back.
And can I also get your reaction to, obviously in our hospitals now and with more hospitals dealing with COVID patients, staff are taking more precautions and they've got more stringent PPE requirements. But a lot of them are telling us that they're not even able to take a break or drink water while they're on shift. Some of them are going 8 hours without being able to get a drink of water because they're not allowed to remove their mask at all while they're in hospital. What are you doing to ensure our health workers can, I guess, A, get through a shift if they can't drink water, and B, make sure we have enough workers in the hospitals?
Look, I think all South Australians have made extraordinary sacrifices since day one with this pandemic, but probably the health workers, the people on the front line, have really been the ones that have really borne the brunt of this. They've turned up every single day to protect lives and keep South Australia safe. These are extraordinary times. Health systems around the country, around the world, and here in South Australia are under pressure. I think we are in a better position than most, but I'm going to be frank. We are doing everything we can to, if you like, slow the spread of this disease so that we don't have people all turning up at once. We've been able to significantly increase the number of beds by decanting non-COVID patients out to the private hospitals, and I do want to thank the private hospitals for working in partnership with SA Health to facilitate this. They've been great partners in this project. But staff are under enormous stress because there are more and more SA Health staff who are either COVID positive or close contacts themselves. So I just want to say a massive thank you to every single person working in SA Health, whether they be a doctor or a nurse, somebody that's working in our ambulance, the support staff, in our SA pathology team. People right across the board are really doing the heavy lifting at the moment, and I'm very proud that South Australia's had the response that we have. Look, it's very concerning to hear that health workers wouldn't have time to, or the ability to take their PPE off to have a drink. I'm very happy to follow that up. I haven't heard that previously. What I am hearing is a lot of very, very hard-working people right across SA Health that are doing everything they can to support our health system during this tough time. I know that these are tough times here in South Australia. It's tough time around the country, around the world. And by everybody working together, we can slow the spread. That's going to lead to fewer hospitalisations, fewer people being admitted into ICU and going on to ventilators. And we have really slowed that spread in the past 2 or 3 weeks in South Australia. So I'm very grateful for that. No, look, we haven't been able to put appointments into the system at this stage. As I said, this is a massive logistical exercise. This is why we're limiting it to people who become close contacts as of today. We believe we'll have the capacity tomorrow, but there are likely to be some disruptions in the first day, and that's why we want to learn from that before we roll out those other sites across South Australia. We will have, I think, up to 12 sites in place in the first week. And I want to really thank our partners in the local government sector who have been able to help us identify sites, both here in metropolitan Adelaide, in the peri-urban areas like Mount Barker, and then right across country SA from Port Augusta right down to Mount Gambier. So there'll be a large number of sites. We're trying to make it as convenient for people as possible. But with any new system, there are bound to be some teething problems. And so we're just asking people tomorrow to be patient. Don't forget, the rapid antigen test is an alternative to the PCR. So if we see a lot of people shifting tomorrow and coming out of the PCR lines, it's still going to be possible for people to go along, have that PCR test on day 1 and day 6 rather than rapid antigen test. It's just another option which is being put forward.
My understanding was that initially, though, it was to replace the PCR test for close contacts to take them out of those large queues for PCR testing. So is it just initially that they will be able to access the PCR test until you find out the teething problems with these RAT locations, or will that be ongoing? And also, do you think that tomorrow, knowing that it's probably going to be a bit of a nightmare queuing for these tests, a lot of close contacts will just decide not to roll up, and therefore we might not have a true picture of the case numbers?
Well, don't forget, if you're a close contact, you're required to do that 7 days of isolation. So if you don't get that rapid antigen test or that PCR test on day 1, you are still required to isolate. But for those people that are asymptomatic, we present another option for them instead of the PCR, where there have been some lines, and that is to collect that, or the 2 rapid antigen tests, and to test themselves on day 1 and day 6, and then to report those results in. This is in line with what is happening in other jurisdictions. What we're keen to do, though, is to trap every single one of these results, put them into our system. We had good reporting already in South Australia from private sector rapid antigen tests, and we expect this to increase. But people still have that choice. If they do have symptoms, we'd much prefer them to go and get the PCR test, of course. But if they are asymptomatic, close contacts, they've got that additional choice now to get the 2 free rapid antigen tests to administer it themselves and put that data into our system.
And just for my final question, yesterday I did ask you about whether RAT tests, it would be mandatory for those results to be recorded or submitted to SA Health, and you said no. What has changed in the past 24 hours?
Well, there was a general discussion today at the COVID Ready Committee, and the position was changed of the committee overall. Nicola Spurry in particular spoke to wanting to get as much good quality data as possible. Whilst we think that probably 95% of people would do the right thing, getting as many results, as many positive results as possible into the system just improves that data. And with regards to managing of this pandemic, data is king. We've seen other states move in this direction now, and so we will update that direction, and it will be a requirement to report a positive case, whether that's on a privately acquired rapid antigen test or whether it's one of the free kits that are provided by SA Health.
Premier, a short time ago I spoke to a cafe owner at Golden Grove who said a police officer entered their premises last night and had an issue with tables being too close together, and then he reduced their COVID management plan to a capacity of 15 from 20, and then they got an email a few hours later with a fine of $10,000. They've been given no warning about this prior. Is this operation limit, or whatever you're calling it, incredibly harsh measure for businesses, small businesses doing it really tough right now?
Look, I don't have any details on any individual cases, but it's obviously there are only 4 expiations that have been provided right across the entire state. It would seem that this person potentially has 2 of those. The fines are $1,000 for an individual, $5,000 for a corporation. So I don't know what those particular infringements are. We could follow that up with SAPOL potentially. But ultimately what I can say is that on the hundreds and hundreds and hundreds of inspections that have occurred under Operation Limit, there have only been 4 expiation notices, and clearly from what you're saying, 2 of them were at the same premises.
You've often spoken how people should book in for a PCR test instead of lining up. We have one case study of a person who had a booking for a big party at 7 p.m. last night, arrived at 6:15 p.m, got on the line, and that line took 7 hours and 45 minutes. Is that acceptable?
No, look, we don't want people waiting in line for any longer than they need to be waiting, but yesterday was extreme weather, today extreme weather again. That's the end of the extreme weather in terms of the forecast, so we're very hopeful that we'll be able to return to a normal processing time. What I can say though is that pathology stood up really well yesterday in terms of the number of tests that went through. In fact, it was higher than the day before, which was a fantastic result. But obviously one of the reasons why we're now implementing the option of 2 free rapid antigen tests provided by SA Health for close contacts that are asymptomatic is that we want to get people out of that PCR testing line. We want to preserve that for people that have got symptoms. We want them to be able to turn up and get through very quickly. What we've seen is the times in South Australia really get down to very good times earlier in the week. They blew out obviously in terms of waiting times yesterday and again today, but hopefully we get back to equilibrium again tomorrow, and that will really be helped by the fact that we're putting these free rapid antigen tests as an alternative into the system as of tomorrow.
When will SA Health make a decision on fringe how or if it does run, and will you consider financial support for freelance people who are freelancing, particularly in the arts industry?
So I think there's not much more than I can add to the question that was asked yesterday. We're looking at those COVID management plans at the moment, but we don't have a crystal ball as to what's going to be happening exactly from the 15th or whatever it is of February through to the 20th of March. But what I can say is we've been working with organisers trying to make sure that we can get as many events outdoors as possible, that we understand about social distancing, about QR code check-in. I think SA Health has worked very cooperatively with Fringe, with the festival, with WOMAT in the past. The good news is they will all go ahead. We are also considering financial support in line with the support package announced only 2 weeks ago, which support those major events which obviously need to be cancelled or modified in any way. So we should have a result on that by the end of this week as well, where we will be able to support those and make sure that we do have a quality Fringe this year.
Sorry, just the final question was about freelance, say artists who are earning less than $75,000 a year.
Well, they of course would have access to the existing program. So with the existing program, we have a hardship component to it. That went live on the Treasurer's website earlier this week. And so if people can show that they have had a real dip in terms of their income, they can apply for that support. And in addition to that, we've massively increased our grants to artists in South Australia through Arts SA. There was another round which was only just recently announced. So we've done everything we can to support artists through a very difficult period of time, particularly our performing artists, who have probably suffered disproportionately because of audience issues, venue issues, and also illness of people within the production. So we're taking all of those things into account with our support packages. I think we're still the only state in Australia which has announced an Omicron specific support package. It's our 7th support package for sectors that are adversely affected by the disease.
Good afternoon, Premier.
Good afternoon, Alan.
With the mandatory reporting of the results, is there really any incentive for people who don't want to report to actually report a positive test? That there's no way really of checking that somebody hasn't reported a positive test? How is that going to be monitored? And what sanctions would there be for anybody who's found not to have reported a positive rapid test?
Well, look, there are always ways people can work around a system, but I'm absolutely convinced that the people of South Australia want to do the right thing. They've certainly shown that since the 26th of December, when we had to put additional restrictions in to protect our population. People have abided by those, and we can now start to see the slowing of those new cases in South Australia. It's been quite a dramatic slowing over the last week. And in fact, I think today is the second lowest day that we've had so far this week, which is absolutely fantastic. We're not seeing that sort of doubling like we were seeing on a pretty short period of time previously. So look, we expect people to do the right thing. It is a direction, and of course, there are penalties if people don't do the right thing. I'm happy to provide that to you. But just like there is with any direction which is not followed, there are expiation notices which can be given to the individual, and in extreme situations we can take them to court. At the moment, I think the expiation fines are $1,000 for an individual and $5,000 for a corporation.
Is there any evidence that the extreme weather conditions and closure of testing stations and the low number of rapid antigen test results reportings are leading to an underreporting of actual cases within South Australia, so that we're not actually seeing the true picture in the past, say, 24 hours?
I don't think so, and I'll give you a couple of reasons why. I think that we still have high rates of testing in South Australia. I think we have the highest rate per capita in the country still. And so we still have a very high PCR testing rate, and we've also got a low positivity rating. So when we look at that, I mean, some states are up around 30 or 35% are positive. We're much lower than that. So I don't think we do have under-ascertainment in South Australia. Sometimes there may be a day or two lag, especially through these hot conditions for people going and having that PCR test. But certainly from our perspective, all the expert advice that we've had is that we're probably very accurate in terms of our reporting, and other jurisdictions have already publicly stated that they're not sure that their statistics are particularly accurate because they have very long lengths of time to get a PCR test result. And so we see very significant reduction off the peak in terms of PCR testing in other jurisdictions, whereas in South Australia we've been hovering around that 18 to 24,000 now for the best part of 3 weeks.
What time does the parklands run open tomorrow, and when the other 12 that you were talking about, or the other 11, when do you anticipate that they will become available? So what time tomorrow
Yep.
For the first one, and then when are the others actually going to come online?
So the Southern Suburbs super site will open at 7 a.m. tomorrow. It will operate right through until 9 p.m. And what we hope to be doing in the next couple of days is announcing the next group of sites. Up to 12 will be in place over the next 7 days.
Thank you.
Hi Premier, it's Steph Richards from Indaly here. Just with that rapid antigen test collection site, can you just explain exactly where in the Southern Parklands it is and what people can expect when they go to collect tests?
So I'll just send a map rather than try to paint a picture for you, but we'll send a map to all of the media today, and we'll obviously have that on our communications which are going out to people. The exact process is this. If you're a close contact as of today, you go onto the SA Health website, you register, you say how many people are close contacts that are living in your home. We will then send you a receipt to your mobile phone number. You'll turn up tomorrow at our site, you'll show that receipt, you'll be given your packs. You then have a requirement to conduct those tests on day 1 and day 6, and then to report any positives in to SA Health. This is an alternative to lining up for a PCR. It's available for close contacts who are asymptomatic, and we're really keen to see people utilise this, but most importantly make sure that that data feeds into our total numbers so that we get a complete picture in South Australia, and that's why we've decided at this point to make it mandatory for positive reporting.
How will you ensure that it's only close contacts that get access to these tests and it's not just other members of the public who might be symptomatic or not even symptomatic?
So we're being very clear about this. People are making an application, they're putting that advice to us in writing, and it's very important that they get that right. Obviously, from our perspective, we'll look at those numbers very carefully. We can see what the new infection rates are, and then we can work out whether we've got approximately the same number of close contacts. So for every positive, there's probably a number of close contacts. We'll look at that pretty carefully and monitor that.
Transporting Anangu people here in Adelaide back to the lands because some of those people had tested positive. What is the government doing to help those people get back to their home country?
So we had pretty detailed plans in place to return some of the Anangu from the APY lands back to the lands. Unfortunately, when we congregated to head off, we administered the rapid antigen test, and we found that there was a large number that had already contracted COVID-19. Obviously, it's a very vulnerable community. Up on the APY lands, a decision was made not to send those buses, and so now we're working with those Anangu in Adelaide, looking at alternative accommodation. Many of them already had accommodation. We're just working through an individual basis to provide support for those who are going to be stranded here for some time. I completely understand the decision of the APY executive to be very cautious. They have had a couple of positive cases there, most recently in Amata, and also I think a positive case in Indalkana. We've sent the rapid response team up to the APY lands because we know that this is a particularly vulnerable community, particularly because it's such a remote part of our state as well. So we're working with the local Nunapa Health to make sure that we're getting all of those tests through very quickly. The good news is we haven't seen a spread on the APY lands because of the very swift action which has been taken there. In fact, I think I reported the other day that of all of those rapid antigen tests which were administered, they all came back negative, and that's continued. So fantastic news there.
Hello, Premier. It's Andrew Huff from The Advertiser. Can I just ask you, before the new sites come online, what do you do if you live in country areas and you want to get access to a rapid antigen test? For example, if I lived in Mount Gambier or Port Lincoln or in the far north, what do I do?
So at the moment, don't forget this is an alternative to the PCR, and the PCR is still available in those communities. But what we've said is that we'll open up 12 sites. One of them is going to be Mount Gambier, and we'll do that in the next week. Some of them could be in the next couple of days. So there's not long to wait, but it's only an alternative to the PCR test. So we just encourage those people where it's not set up yet to continue to use the existing PCR testing capability.
Decisions made when it comes to implementing this new rapid antigen testing rules?
Well, nothing could be further from the truth. I think that we've done extraordinary preparation for the rollout of the rapid antigen test as an alternative to the PCR, and I think people will see that. Obviously, day one, day two, there's going to be some bedding in issues. We'll get all of those right before we roll out those other sites. But since day one, testing in South Australia has really been the backbone of our response. We've had very good testing. In fact, the highest testing, I think, in the country per capita. We've also had very low turnaround times compared to many other parts of the state. But we are dealing with a global pandemic. There is a massive surge in the demand at the moment right across the country, right across the world. I know that the very hot conditions in South Australia have caused some delays as we've had to close those sites between 10:30 in the morning and 5:30 in the afternoon to look after our staff, but then they've continued to go through, many of them through the night. Yesterday was actually an increase in terms of the PCR tests administered in South Australia over the previous day.
Can I just ask you on the modelling, if I may? The modelling you suggest is that we're going to be well under the capacity for hospital beds, and the case numbers have slowed quite dramatically because of the restrictions. Obviously, you've announced some very sad news with the 7 cases, I think, if I remember correctly. 6 ladies and a man. Does that correspond with your modelling on the number of deaths that we were going to get from the Delta strain, which from my memory was about, I think, was it 13 or in a year from the deadly Delta strain? Is your modelling corresponding with that?
I think these are two completely different strains, Andrew. Look, the reality is the numbers that we've already had through with Omicron completely eclipse any projection that we had with Delta. In fact, as you would all know, the number of Delta cases that have ended up in hospital, in ICU, on ventilators has been just a fraction of what was envisaged, and so we really did prepare extraordinarily well for the opening of the border on the 23rd. The new Omicron was only advised to the World Health Organization on the 24th. We found out about it globally on the 26th or the 28th when they declared it a variant of concern, and we've all been trying to understand what this means around the world. What we do know is it's highly transmissible. The current vaccination rate does slow the symptom spread, but it doesn't actually particularly slow the transmission compared to the previous Delta strain. So there's more work with that booster to do. But what we will do on Friday or Saturday is to give you a clear picture of where we were with Delta, where we were in the early days of Omicron, where we are now, and then try to give us a projection of where we're going forward. But all of those projections show that we have got the capacity with Plan 500 to meet all of the hospitalisation requirements of those people with this current wave of Omicron. Now, there are lots and lots of provisos in that and lots of assumptions in all of that modelling, and that's why every day that we get actual data in, it proves up that model and makes the projection forward look, it makes it more accurate for the planners. But what we do know is that we have put significantly more beds in place through Plan 500 than what we need at the peak. That peak is likely to be before the end of this month, sometime in the 3rd or 4th week of January.
Thank you, Premier. We appreciate your time.
Thank you.